What exactly are Medicare Part B excess charges, and how does it affect you? Hi, I'm Jessica Mannion at My Healthcare Direct, and today I'm going to be going over what Medicare Part B excess charges are and how you can avoid them. So what are Part B excess charges, and why should I know about them? Well, you want to know about them because if you're planning on enrolling in a Medicare Supplement Plan N, or if you're just staying with Original Medicare, you may experience some of these excess charges. So if you fall into one of those categories, it's important to understand what these are and how they affect you. Part B excess charges are when a doctor does not accept Medicare as the full payment for services provided to their patient. In this case, if a doctor does not accept Medicare Assignment, they can charge the patient up to 15% more than the Medicare approved amount. These excess charges are also called balance billing. How do excess charges work? Let's say you visit a doctor for a test. If the Medicare allowable amount for this test is $400, the doctor can bill you up to 15% of that $400, or $60. Bringing the total cost of the test to $460. If you had already met your Part B deductible, then you would be responsible for paying the $60 excess charge and then 20% coinsurance of the remaining amount, which would be $80. So your total expense for this test would be $140. Now, if you have a Medicare Supplement or a Medigap plan that helps cover the excess charges, then you wouldn't be paying anything for those services. However, if you do have the Plan N, then you may experience paying that excess charge after all. How do you avoid these excess charges? Well, there are two easy ways to avoid excess charges. The first is by purchasing a Medicare Supplement plan that covers your excess charges. That way, no matter what state you're in, you'll never experience those excess charges because your supplement will help cover those costs for you. The second way is by making sure that your doctor accepts Medicare Assignment. There are two ways that you can accomplish this. The first is by contacting your doctor's office and simply asking them if they accept Medicare Assignment. If they do, then you should not experience excess charges with that doctor. The other way is to check online by going to Medicare.gov and searching the doctor's name to see if they accept Medicare Assignment. If you want to quickly look online and see if a doctor accepts Medicare Assignment to avoid excess charges, I'm going to show you how to do that. So the first step you're going to want to do is go to Medicare.gov's website. Once you get to their home page, you're going to want to find the binoculars that say Find Care and click on that button. Once you do that, you're going to see another button that says Doctors and Clinicians in the middle of the page, and you're going to want to select that. Once you get to this page, this is where you enter the location you're looking for, and if you already have a doctor in mind, you enter the doctor's name there. So in this case, I'm going to put Tampa, Florida, and I'm going to put Tampa General. And I do see that a Tampa General Medical Group under General Information does accept the Medicare approved payment amount. This means that if I went to that medical group, I would not experience any excess charges. There are currently 8 states that do not allow excess charges, and those states are Connecticut, Massachusetts, Minnesota, New York, Ohio, Pennsylvania, Rhode Island, and Vermont. So if you are living in any of those states, you should not experience any excess charges, regardless of whether you're on just Original Medicare or if you have the Plan N. Again, excess charges are a rare occurrence, but they can happen. So it is important, especially if you're going onto Medicare for the first time, that you understand what these charges are. If you have more questions on excess charges or any other information regarding Medicare, please feel free to contact our office at 888-959-1028.